Well, if you were a new patient and you came to my practice, the first step would be to fill out forms. Now, some patients do this online, and we hope to have this computerized in the very near future, where it can be entered electronically online, not just a copy of initial patient questionnaire. The patient will answer the questions. The new patient questions. They're triaged by one of the medical assistants. They go into a separate room, a private room. Their blood pressure gets checked, their weight, the rest of the vital signs, the heart rate, the respiratory rate, and their temperature. Those are all the basic vital signs. The medical assistants get a list of all the medications. They get a list of the allergies. They go over the patient questionnaire regarding the family history and enter that data in the computer. Family history, surgical history, any other history that they can enter. Then the patient goes back. You would go back to there may be a second triage room, depending if the room's not available. Ultimately, you are seen by a physician or a provider in one of the exam rooms. The provider comes in, we have electronic records. The notes are already there, the allergies, the vital signs, the basic history's already there, the medications. The provider goes through everything and then audits the chart to make sure what the medical assistants wrote is accurate, or they update things. Sometimes patients don't remember everything, and then more information gets entered into the computer. And then the physician does what the patients came in there for, whether it's a physical or a sore throat or just to get established. Sometimes if they've been seen by their doctors, when they ultimately leave, we ask them to request to sign a release for old records. We have a section in our computer where we enter the old records after they're reviewed. When you leave the exam room, they can pick up medication at the pharmacy. They need a test, an EKG, we can get the EKG done. We can get an echocardiogram done, or if it needs to be scheduled at a later date, it gets scheduled for a later date. There's a separate schedule for echocardiograms, DEXA scans, ultrasounds. They can come back at their convenience for that. The lab's right there. They can do the labs the same day. They can do them another day at their convenience, even on Saturdays at their convenience. And the results all come back to me. They all land on my desk or my computer, and I look at everything in as timely as fashion as I can. And if anything's urgent, it gets taken care of promptly. If it's not urgent, if it could wait till the next visit, we discuss it at the next visit. We update the problem immediately in their problem list so it's there. And that'll be our cue that that's one of the issues to talk about. Sometimes the patients are seen, they might be seen by a different provider who didn't have the initial contact with the patient, so they don't know what the issues are. So all these details are put into the computer.
The physicians, nurse practitioners, and physician assistants that work with Dr. LoCicero work very closely with her, and we take a team approach to people's health care. Oftentimes when somebody has an urgent problem, they may not necessarily be able to get into our office to see the person they normally see, but they can be assured that the information that is gathered by any one of our providers is shared by the entire team.
For patients, I think it's easier to come to a primary care that offers multiple services because they can be done all on the same day, and people work busy lifestyles and it's hard to get time off, and you can come in and fully do a full annual physical here in the office with our own lab work being drawn here and EKGs being here and DEXA scans and ultrasounds. So it's kind of like one stop for your whole preventive annual screen.
What we like about the office today is that you come in for lab work, or they send you out for lab work, or they send you to a specialist, they get results, and they act on it immediately. They don't wait for something to be wrong and then call you. If it's good, they send you a letter, or they call you, they tell you no problem, everything is fine, and if there's something to be taken care of, they tell you, just like currently. My wife will be here next week because there's something that was found within her blood, and they will handle that. In my case, I had a problem with my esophagus. Dr. LoCicero, followed it up until finally we discovered, and we wound up to the referral point of Moffitt Cancer Center. And were in other doctor's office, I'm sure they would have, but it wasn't. This was so expedited. It was boom, 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 boom. You got to do this, you got to do this, you got to go here, you got to do this. You can't just wait, you can't hang around. And she would pursue it until I wound up with Moffitt Cancer Center, and they discovered that I almost had cancer in the esophagus. And they were able to take care of that. And right now, I visit Moffitt twice a year for a follow-up to make sure that it doesn't come back. So thank God to her office and her persistency of follow-up, that I'm able to not say, thank you, I cannot tell you I have cancer.